So what are the attachments of the scapula? Mainly asking in Viva, 90% of the faculty is asking this coracoid process attachments. It is a atavistic type of epiphysis. It is having the tip of the coracoid process. It gives two muscles origin. One is coracobrachialis and short head of the biceps brachii. It gives attachment three muscles, three ligaments. Mainly, at least you tell origin of the short head of the biceps brachii and coracobrachialis. Whereas the medial side, here the attachments of the insertion. See, we are using this insertion of the pectoralis minor. So, pectoralis minor for the insertion, coracobrachialis, short head of the biceps, origin. So, these three muscles takes origin from this attachment to the coracoid process. Not only this, and also gives attachment to the ligaments, coracoacromial ligament, coracoglenoid, coracohumeral ligaments attached to this coracoid process. Next, another one here, acromion process. This is the acromion process. Posteriorly, here trapezius muscle attached to this area, trapezius muscles insertion to this acromion process and spine of the scapula. Whereas the origin here, deltoid muscles. So anterior border deltoid muscle, posteriorly insertion for the trapezius. Next, whereas here the surfaces, costal surface, this whole surface gives origin of the subscapularis muscle. It is a multi-pennate muscle that goes to insertion and make a rotatory cuff of the shoulder joint, going to insertion at the lesser tubercle of the humerus. This is a multi-pennate muscle, subscapularis muscle. Next, whereas the dorsal surface is there, dorsal surface divided by the spine. This is the infraspinatus muscle takes origin. Infraspinatus muscle takes origin from here, and this is the supraspinatus muscle takes origin. Supraspinatus muscle above the spine, infraspinatus muscle below the spine. Dorsal surface, two muscles, infraspinatus, supraspinatus. Whereas the costal surface, subscapularis muscle. Next, whereas here this is the medial border above, just above the spine. Here the muscle levator scapulae muscle insertion. Next, below the spine, from here to here, this is the rhomboides minor. Below, towards the inferior angle, this is the rhomboides major muscle. So here, see, this is the rhomboides major muscle, this is the rhomboides minor, levator scapulae muscle. Next, whereas inner surface of this medial border gives insertion for the serratus anterior muscle. This is if the paralysis of this muscle, this happens to winging scapula. This is the medial border, costal surface towards levator scapula, that is the serratus anterior muscle insertion. Next, whereas the lateral border, this is the glenoid cavity going to articulates with the head of the humerus to form a shoulder joint. This is the lateral border, rounded. It is extend from the infraglenoid tubercle to inferior angle. See, just above here, that is the muscle, that is the teres minor muscle, and teres major muscle takes origin from here. Teres takes origin. So we can use this pen, chalk piece. This is a teres minor. This is a teres major muscle. Teres major, teres minor muscles. Next, whereas here below the glenoid cavity, there is tuberosity is there inferiorly that takes origin of the long head of the triceps brachii. See here, glenoid cavity below tuberosity is there, that is called the infraglenoid tubercle for the origin of the long head of the triceps brachii. Next, another one here, see, this is a supraglenoid tubercle is there, supraglenoid tubercle. This is for the origin of the long head of the biceps brachii muscle. This is the only tendon crossing this shoulder joint into the cavity of the shoulder joint. So this is the long head of the biceps brachii. This is the long head of the triceps brachii. This is the teres minor muscle, teres major muscle. Next, another one here, origin of the latissimus dorsi muscle. Inferior angle is the latissimus dorsi muscle, it crossing of the latissimus dorsi. So latissimus dorsi, teres minor, teres major, whereas here levator scapulae, rhomboids minor, rhomboids major, dorsal surface, this is the infraspinatus, this is the supraspinatus, this is the subscapularis muscle. Here three muscles, that is a pectoralis minor muscle insertion, short head of the biceps brachii muscle takes origin, and coracobrachialis muscle takes origin from here. Next to another one, acromion process. Here this side is the anteriorly deltoid muscle, this is the posteriorly, that is the trapezius muscle, it extends up to the spine, inferior lip, spine of the scapula. So these are the muscular attachments, origin, insertion of the muscles. Main important question they are asking, coracoid process. What are the muscles attached to the coracoid process? Next, another one, what are the ossification centers? So here one primary center is there, one primary center, 7 secondary centers. See here, one primary center that is present here, that is present in the see, one primary center that is present in the just below this body, one primary center, remaining is the 2 secondary center coracoid process, 2 in the glenoid cavity, 2 in the acromion process, another one is that is the middle border of the scapula. So 7 secondary centers, one primary center is there. Next, what is applied anatomy to know this? Applied anatomy, winging scapula. Winging scapula. What is winging scapula? You can read in the theory part. Thank you.